physician shortages on the Central Coast are significantly contributing to the health disparities we see.
Natalia Diaz and Michael Parr, seen here with their faculty advisor, know all about health disparities. Both grew up in Salinas and are now pursuing their medical training at UC Davis, both with plans to return home after graduation to practice.
Serving my community was actually the reason I wanted to become a doctor. I saw firsthand how my family and community were not being treated in the same way because of language barriers and cultural barriers. I spent most of my time translating documents and doctor visits when my grandmother got sick with cancer.
So for me, returning home is really important just because I have my family there, my wife's family, and for me that's the area that gave me the opportunity and the structure that eventually led me to becoming a medical student and future doctor.
Natalia and Michael are what are commonly referred to as homegrown talent, training local young people with the hope that they'll stay here on the Central Coast. It is one part of dealing with the doctor shortage.
More than half of physicians tend to remain in a 100-mile radius of where they trained. And the Central Coast only has 2 residency programs and no medical school in the region. And so if we really want to recruit more doctors to the Central Coast, we need to be thinking about how to expand training opportunities in the Central Coast for physicians both in medical school and in residency.
And UC Santa Cruz, partnering with UC Davis, is attacking that issue head on with an ambitious plan to open a new medical school. Students will initially do their classroom training at Davis and clinical training here on the Central Coast. The idea is to also provide those students with enough financial support to make it viable.
Lets us start fast but small. So we're going to, starting next May, we're going to look to admit 6 students per year. Our goal is to grow that out over a decade to 16 students a year. But the ultimate goal is to form a freestanding medical school on the Central Coast.
But that will take time and a boatload of money. An estimated 15 years for a full-fledged medical school and hundreds of millions of dollars. The PRIME program, as it's called, this collaboration with UC Davis, is a start, and it will lean heavily on local hospitals to make it successful. Right now, Dominican and Natividad have residency programs. Salinas Valley Health and the Community Hospital of the Monterey Peninsula are looking at establishing them.
Need to increase the pipeline, right? And you do that by creating those training programs that will allow those young professionals, whether they're physician assistants or physicians, to do their training here in Monterey. It really is that grow your own sort of philosophy.
Cal State Monterey Bay did have a fledgling physician's assistance program, but lost its accreditation in 2023. It is now looking hard at restarting that program. The new Dean of Health Science and Human Services says the university is in the process of a feasibility study right now to decide what programs it can and should offer in the future.
We're hoping to have a very solid direction within 6 months about where to go next. Now that's part of the puzzle, is to once we kind of decide on what provider program we're going to offer, the next piece is making sure we have state, local, even federal or community support, financial support to get those programs up and running. Because those can cost anywhere between $3 to $5 million.
Millions and a 2 to 3 year ramp-up period at a minimum. But physician's assistants, nurse practitioners, they are part of the solution, a so-called care team, allowing doctors to concentrate on the more complicated cases. The problem is we don't have enough of any of them.
There needs to be a huge investment in workforce. I mean, yeah, I think you may even hear about it today. UCSC is working on a medical school, which is fantastic, and Cal State Monterey Bay is working on an PMPA program. I can tell you the numbers of people that are talking about putting out are a fraction of the needs. We need to invest in this.
That's Dr. Alan Radner delivering a keynote address at a local economic forum and one of the loudest voices calling for a real community commitment to train and educate the next generation of healthcare providers, offer scholarships, those residency programs, and most importantly, make it easier for new docs to come home.
During my third year clerkship, I was able to go back to Salinas to work with the Natividad Hospital and Clínica de Salud del Valle de Salinas for my obstetrics and gynecology clerkship, and it was just a fantastic experience. It really is the highlight of my medical education training, and I'm so thankful for both entities to be able to allow students like us to be able to return to our communities.
One part of this equation that we haven't talked a lot about is technology, specifically AI, already being used to increase physician efficiency, allowing doctors more time to see more patients, and that will likely increase as AI develops. But technology alone will not solve this problem. It is an all-hands-on-deck kind of a challenge that will require investment, meaning a lot of money, as well as community commitment.